So thank you very much for this invitation and this very important symposium. It's a new area in upper urinary tract endoscopy. So we said previously that there are some drawbacks in flexible ureteroscopy, especially for reusable. And one of the main drawback is probably the fragility. When we start all of them, flexible ureteroscopy in the kidney, probably all of you and Olivier remember that we could perform more than 20 or 30 flexible ureteroscopy with the reusable without any breakage. And right now, this fragility is increasing, and probably the duration of the reusable ureteroscopes is close to 10 to, or in between 10 and 20 procedures. And when you send your flexible reusable ureteroscope to the manufacturer for reparation, they return you not a new one, they return you a repaired one. So more you use your flexible reusable, more it becomes fragile. So that's why we observe in our center that the duration of our reusable ureteroscopy is decreasing. And of course, another drawback is the cost, and you have here the cost in euros. But this is the direct cost. There is a lot of indirect cost, and it depends on the study of what we include in the cost effectiveness study for the evaluation of the cost of a flexible ureteroscopy. It includes repair, postponed procedure, cleaning, morbidity, and of course, and we will see that it's probably one of the most important points for single use is the waste management. What about the cancellation? We review in Marseille 3 years ago the rate of cancellation of planned ureteroscopy. More than 400 ureteroscopy in 2017. 1/3 were postponed, and 30% of the planned ureteroscopy, that means 40% of the postponed ureteroscopy, were due to unavailability of the reusable. 30%, 57 patients. If we look at the cost and the breakage, the main drawbacks of reusable ureteroscopy, these data are from a very nice paper from Canada, Quebec. That's why it's in French. But if you can see here, even the mean number of cases before a breakage of a reusable flexible ureteroscopy during the recent years. And you see that there is a very small cases per endoscope before breakage, in between 7 and 12 cases before breakage. And that means, it could be translated in the risk of breakage when you plan a flexible ureteroscopy. And this risk is 6%, 6% of risk of breakage. And in this study, the duration of reparation of unavailability was 14 days. In our center, it's much more longer. Here you have the cost of the procedure, but it's very difficult to compare in the same study, in the same country, the real cost of flexible ureteroscopy with reusable or single view. What you can see, there is in some series no extra cost, and in other series there are a lot of extra cost from the simple to the double cost. Okay, We go back to our study and to the 57 schedule postponed ureteroscopy because unavailability. And in 2017, the length of unavailability, we had 5 flexible reusable ureteroscopy, was 200 days. 200 days. That it's close to 6 months. 6 months. And the repair cost was different between the fiber and the digital fiber flexible ureteroscopy. It close to 10,000 euros a year for a 1 ureteroscope fiber, and it was 15 euros for a digital one. That's why very, very high. And we published our series 2 years ago about this evaluation, and we perform we include in this study 300 procedures. We had 5 reusable flexible ureteroscopy, and for our procedure, we had every day in between 1 and 3 ureteroscope. That means in some days we had no available flexible ureteroscope, sometimes 5, but most of the time it's close to 3 ureteroscope in 5. The cost of repair of this reusable for the year was 73,000 euros, and the mean duration was close to 6 months. In 2017, we introduced in our practice the single-use PUSEN ureteroscopy, and we can perform ureteroscopy because of this single use in close to 100 cases. And it cost to our center 19,000 euros. Here are the detail of the cost, the consumables, the water, transport, paramedical staff, and here are the cost for each ureteroscope during 1 year in 2017. And you see here the cost, and here you have the fiber one and the numeric one. This cost is very cheap for this numeric, because remember that usually it's close to 10,000 euros. And the mean repair for a year for a reusable flexible ureteroscope in our center was 10,000 euros. So if we look at in this same study, the availability of reusable ureteroscope in orange, this is the curve of the availability. And as you can see, in May 2017 and in November, in 5 ureteroscopes reusable, we had no reusable available for the procedure. Hopefully, we had the single-use plus one, the standard one, and we can maintain our activity of planned ureteroscopy. Always for the cost, and we spoke about that during the previous presentation, there is the length of the cleaning, and in our center it's 1 hour, 40 euros. The cost per procedure for our activity was more than 300 euros, but including purchase, cleaning, sterilization, and so on, including bacteriological testing. But we had to add the repair, and the repair depends on the volume of the activity. For example, the cost of single-use flexible ureteroscopy, it depends of the country, depends of the center, is in between 600 and 1,200 euros, and I think it's closer to 600 than 1,200. And we can estimate another cost of 300 euros, but it's very difficult to compare because these costs for a procedure with a single flexible ureteroscopy depends of the volume of the activity a year that we can resume as the profitability. And we evaluate this profitability in our center, always in the same study. Here in gray, you have the cost of reusable flexible ureteroscopy in 2017, here in gray. In comparison, the orange line was the cost of reusable in between 2011 and 2016. And that's to demonstrate you that actually the reusable are more and more expensive. So if here in yellow is the curve of the expense of the reusable, and the point of the crossing of the two lines in our center, and the cutoff of profitability was in this year 73 flexible ureteroscopes. Since this year, we increase our activity because of unavailability. And before the COVID year in 2019, we performed 220 single use flexible ureteroscopy. That means 60% of our activity of retrograde intrarenal surgery was with single-use flexible ureteroscopy. Last year was, as you can imagine, an exceptional year, but actually we are slowly moving to more and more single-use ureteroscopy for our intrarenal retrograde surgery. In the literature, this cutoff of profitability varies from a small cutoff in between 30 procedures a year to close to 100 single-use flexible ureteroscopy procedure a year. So in our center, it was 73 procedures for this cutoff. So that's the cost and the cost of the single-use ureteroscopy, which is quite difficult to evaluate, and each center has to perform this kind of evaluation to have this cutoff to select the ratio of single-use versus reusable procedure. And what is very important, and for me, it's I think a main point for the single use is the waste management. More often, when you discuss with colleagues, they say that single use is very bad for the environment. In fact, we evaluate the waste management in our center. You use, in our center, we perform high-level decontamination with peracetic acid. Some centers use stearate, but our center we do not have the stearate. You use a lot of water, disposal kit, sets, material, and we talked previously about the carbon footprint. For example, and we do a study comparing the waste management for a reusable cystoscope and single-use cystoscope. And for example, for decontamination of a reusable cystoscope, we use for each cystoscope 60 liters of water and 800 grams of waste. 800 grams. It's probably the same for ureteroscopy. And it must be compared to the PUSEN, the regular one, 200 grams, and the midi-PUSEN, 177 grams. And this single-use ureteroscopy are managed with incineration. And on okay, on this slide is probably one of the most important slides of this webinar, in my opinion, is the waste. And this is a picture of the waste of tools used for the decontamination of a cystoscope. And you must add the water and the acid peracetic. So in conclusion, so actually, sure, single-use flexible ureteroscopy is slightly more expensive than reusable flexible ureteroscopy. That's why it can be used in selected cases. But this price depends on the purchase of flexible ureteroscopy, reusable and single-use, and the volume of activity, as we saw. And for the future, for our children, single-use flexible uroscopy is better, much better and better than reusable. So in the next future, quality, safety, cost, ergonomy, ecology, we will switch to 100 single-use of medical material, especially for ureteroscopy. Thank you very much.
Thank you, Eric, for this very nice experience regarding cost and also cost evaluation. Because in fact, what we can understand is at your place, this is cost effective because you evaluate this. We also realize that all of us, if we would like to know if it's cost effective or not, we will have to do exactly what you did. We need to have this evaluation. Otherwise, it's very difficult to tell the people, the administration in the hospital, that there is a benefit or not using a single use. But again, if we listen, Evangelos, for example, because he mentioned that, he said that in his country, in Greece, in Patras, it's probably not exactly the same. So cost is really an issue. It will probably become much easier in the future, since the price are becoming also are decreasing actually. And if I remember, the first introduction of a single-use flexible ureteroscope, it was from Boston Scientific. And I remember at the AUA, it was in San Diego. What about the discussion? All the people were complaining to explain that it was just impossible to use single-use because of the cost, and also because it was not green. And many people were complaining with that. And you can see that after a few years, it looks so evident, so easy to understand that the way the future of flexible ureteroscopy is single-use. And at the end, it's green. As you nicely demonstrate when I saw your pictures. And for the costs, as always, regarding new technologies, we know that in few years, it will not become again an issue. So, Eric, what is your recommendation to do this evaluation in our centers? What do you recommend to the people to start this evaluation? How to do it?
It's as you mentioned, it's very important to perform it in each center, but you can't do it alone. You have to include in your process the drug specialist, the infectious specialist, the economist of your center, and every specialist can evaluate the real cost, because it's obvious if you only take in count the direct cost, there is no doubt reusable wins. But when you include the indirect cost and for especially the postpone and the cancellation and the cancel procedure, it becomes an advantage for single use. So you have to build a team with your director, with your administrator, with your infectious specialist and urologist. And this is the team who can have the good arguments to defend this, the single use in your center.
Thank you, Eric. So